I would start our conversation that, okay, ICU Specialist, okay, what do you do with data science? And what problems bring you to use data scientists?
Okay, thanks, Mahdi. Thank you to the organizers for inviting me here. Just one correction. I'm not a data scientist. I'm a doctor. I'm a medical doctor. I work closely with people who do data science because I think it's integral to what we do, and it's integral to healthcare going forward. And so that's just one correction. So just to answer your question, I'll just begin with, I'll just begin with probably I'll open with the fact that access to quality healthcare is a problem. All right. And that's a problem pretty much universal, but it is definitely exaggerated in developing countries like India. And that's something that needs to be addressed, and I think technology is going to be one of the things that address it. Be that as it may, healthcare, the way it's delivered today, in my opinion, is slightly dysfunctional. As a healthcare giver, I'm coming from that perspective, from that viewpoint. If you think about it, there has been a deluge of data. There's so much of data, so many new medications, so many new therapies, so much new evidence over the past few years. And what a doctor or a clinician or a caregiver is now required to do is, or is not required to do, but is doing, is being a computational machine. You know, I'm constantly challenging my memory, and most doctors are, when a patient comes in to try and remember, is there an interaction between two of the medications that they are on? Is the medication dosage an appropriate one based on what the patient's kidney function is? Is there any implications of a past medical disease that he has on the treatment that I'm giving? It's a constant challenge to my memory and my computational ability. And I don't think human beings are good at computation to begin with, and I don't think doctors are particularly good either. So, if I have to see a patient for 15 minutes, most doctors who have to see a patient, and probably you may not even have 15 minutes because you have so many patients and such few doctors, you spend a majority of that time just doing this computation, challenging your memory and trying to figure out, is this react with that or not? Things that, frankly, computers can do better than human beings. And as a result of which, what ends up happening is that you spend a majority of your time doing this, and you spend a very short amount of time contextualizing that data and making it appropriate and communicating it with the patient. Communicating it in a way, packaging it in a way, and spending time to explain to the patient and come up with a treatment plan that is keeping in line with their preferences and their value systems, right? So what ends up happening is that I'm constantly trying to be a computational machine, and I spend very little time on what human beings are good at, and probably can't be replaced by machines, which is talking to patients, the interpersonal aspect of healthcare. That's where machines are not going to replace doctors, right? So that's where I find that healthcare as it is today is slightly dysfunctional. And going forward, that's what, I think is going to change. There are a lot of people doing interesting things on the fringes of mainstay healthcare. Mainstay healthcare, this is the problem. On the fringes, you have people doing interesting things where they're utilizing data science, to solve some of these computational problems. And my hope is that, doctors will adopt data science to solve some of these problems. Because what ends up happening is when you constantly trying to be a computational machine is that you make mistakes. You forget stuff. You make misdiagnosis and things like that. I mean, there have been several studies. I think there was a study in the Journal of Patient Safety just a few years ago, which this was in the United States, where they had estimated that there were close to 200,000 avoidable deaths per year. 200,000 avoidable deaths. That's just avoidable deaths. That's not even including, misdiagnosis and morbidity and accidents, etc. So that's a huge number, and I don't think that I would be wrong to hazard a guess that that number is an order of magnitude larger in a developing country like India, right?
Do you consider as a quality of healthcare that we can provide to people? Because, from the healthcare perspective, quality has other meaning. But I would say from the data science perspective also, it's very easy for data scientists to fake the results. Define a machine learning algorithm that give you prediction with 95, 99% accuracy. And then it's because it's healthcare and it's very sensitive area. And indeed, it has an effect on the human life and human and also public health. So I would also ask you to discuss about more quality of from the healthcare perspective that you are looking for from data science.
I think a good marriage of data science and physicians is what is required to solve a lot of the problems. Because I don't think data scientists alone will be able to contextualize what the problem or what question that needs to be asked and what sort of solution that we're looking for. Just in the earlier talk, somebody had mentioned, looking back, you can look at mortality rates, looking at registry data, you look at mortality rates and come up with some sort of a thing that this predicts mortality rates. As a physician, that's usually not how I approach a patient, right? When I look at a patient, what I'm trying to figure out is what should I do next that is in the best interest of the patient. I'm not trying to figure out, does this patient fit into this bucket? And I'm in retrospective data, I'll find that this is the mortality. That's not how we think. So I do think, and I do believe that there is a role for data science to guide each decision-making step that a physician takes. We talk about clinical decision support quite often, right? And we're only going to be able to come up with a successful model of clinical decision support when physicians work with data scientists. And I agree with you that physicians are not great at working with data scientists, or for that matter, even adopting technology. And there are a couple of reasons that I can think of. Well, firstly, I think human beings don't like change. That's just the nature of human beings. They don't like to change. And maybe that is slightly exaggerated in healthcare professionals. I think that may, we spend, even with known therapies, with known medications that have been proven to work, it takes a long time to actually, sometimes years and years and years before they become common practice. That's just the nature of medicine. For some reason, healthcare has this inertia against change. And secondly, I think, incentive is a problem. I think in healthcare, up until now, at least, there hasn't really been a strong incentive to change practice and to improve care, to improve quality, to use whatever resources you have available, be it data science or whatever it may be. That strong incentive has just not been there. And it is coming now. It's coming in different forms. It's coming in terms of policy. It's coming in terms of commercial and competitive advantage. So these incentives are coming now, and my hope is, and I think it's probably inevitable that it will continue to happen. I mean, just to give you an example, right? I mean, you didn't even have digitization of data till even 10 years ago. I was a doctor in the US in as late as 2009, which is not that long ago. 2009, I think the iPhone was already in its maybe 3GS or 4 avatar, and you had Netflix. And even in the US, we were, handwriting patient charts. We were, all of patient data was handwritten. There was no digitization of data. There was no access to this data. And then a couple of years later, there happened to be the Affordable Care Act that came in the US, which then created an incentive for digitization of data, right? They said that, we'll give you so many dollars if you adopt electronic medical records and digitize all your records. And you know what? We won't pay you if you don't do it. And then today, you have close to 100% digitization, right? So incentive happened, digitization happened. And I think that's, policymakers, are going to drive to a large extent this shift and change the incentive, where there is an incentive for physicians to digitize their data. There is an incentive for them to use data science to deliver better quality care. So that's where I see it going.
Yeah, but I would mention that when you are talking about digitization, the next topic comes up with privacy and security. What do you think about security and privacy in the digitization area?
Yeah, I think there is. We need to find a good balance, right? It just comes down to that. You cannot have personal health information just floating around without people's consent and in anyone's hands. You certainly can't do that. But at the same time, you cannot build such impenetrable walls to having data accessible or interoperable, because that's what you require to come up with new solutions. It's going to be required. So there has to be a good regulatory framework. I think in Europe you guys use GDPR. In the US there's HIPAA. In India they're working on it. I know the Ministry of Health and the Ministry of Electronics and IT have the Personal Data Protection Bill. They have the Disha Act. These are both draft bills. My hope is that they will come up with a good regulatory framework where these issues are addressed, issues of personal privacy, protected health information, consent, and at the same time, they should at the same time encourage innovation and use of data to come up with better solutions, because that's what we need. So while ensuring privacy is important, at the same time, you cannot kill innovation too.
So I would back to what Parvati mentioned about healthcare in SCG, that is about accessibility. And when we talk about accessibility, without quality and affordability, it doesn't have any meaning. So I know that what you are working in your company is a very good example of covering all of these three. And I would ask you to explain what you do in your company and what's the impact of the product that you have in your company on covering all these three.
Sure. So happy to address that question. But I think these form the basic tenets of healthcare access, quality, affordability, or cost effectiveness. So just to go back to what we do, I am an ICU specialist. I'm a doctor. I specialized in ICU medicine. And what we do, our company's called Cloud Physician Healthcare, is we provide ICU expertise to hospitals that don't have access to ICU specialists. ICUs are the place where you have the sickest of the sick patients in hospitals, and they are the patients that require access to specialist doctors, and very often they require this access at a moment's notice, because that's how quickly things can change. So what we are doing at Cloud Physician is we are based in Bangalore, where we have a command center of an ICU specialist team, which includes, it's a multidisciplinary team, includes doctors, nurses, pharmacologists. And using technology, we connect our command center to hospitals that don't have access to these ICU specialists. And we monitor their patients and provide them with the expertise that they need to manage these patients. Often, saving some of these patients' lives, but very often improving the quality of care that they receive. And so we've been doing this for the last 2 years, and again, I'll just touch on how I believe that data science is going to help us with this, right? So we use technology. In this day and age, you have 4G, which has penetrated most of the country. So, we have hospitals that are our clients in close to the border of Nepal. It's a really rural place because they have 4G connectivity there. But at the same time, we need to ensure quality and affordability and cost effectiveness. So how do you do that? Quality is, we ensure quality by picking up deteriorations in patients' quicker than they normally would have, right? We have data coming on to our platform in real time. We have an analytics engine which is able to sort of tell us which patient is deteriorating or which patient needs special attention. So the data science is helping us ensure a level of quality. And in terms of how do you make this cost effective, that's a really important question, right? This is a far off place in a rural place in India. Clearly, the paying potential of the patient there does not compare with the paying potential of a patient in Hyderabad. So how do you create a system where you can have a specialist who could see a patient in Hyderabad and get more money, see a patient in this place in rural Bihar? How do you make that a viable business model, right? And again, to do that, data science is how you do it. What we need to do is we need to augment the capability of the physician, where if he could see 10 patients in Hyderabad, he should be using technology, using data science. He should be able to monitor, and he should be able to see 30, 50, 100 patients spread across the length and breadth of this country. And that's what makes it a viable business model, right? Because then you don't need that patient to pay as much as the patient in Hyderabad, because you've just exponentially increased the ability of this same specialist to see a lot more patients and make it a viable business model. So that's what we're trying to do, is that, we've assembled a team of ICU specialists here, and we use technology and we use data science to augment the capability of these specialists to see more and more patients spread across.
Yeah, in the morning message, Ayesh mentioned that healthcare is a field that's still a lot of work. We should work in India, and there are few works that are done in this field. It's very interesting that you started. I hope the best for you. But my question now is, what kind of challenges you are already facing with them?
Yeah. See, one of the biggest challenges to doing a lot of what I was talking about is the fact that you just don't have access to data, or it is, in an unstructured format. Somebody is writing something on a piece of paper, or you have a monitor that is, not integratable, or you have a lab system that you cannot get the results from the lab reports onto your system. So that forms a lot of the challenge that we have, and that's really what we're trying to solve. Is, what we're trying to do is we're trying to get all of this data in an electronic format where we can use data science to actually solve some of these problems. And in order to do that, we use computer vision, we use OCR to convert text to digitized format. We use computer vision to analyze ventilators are breathing machines. The data that's on a ventilator, the data that's on a monitor, convert that into a digital format. So we have a lot of, and again, one of the other places where you have all of these in healthcare. There are lots of problems in healthcare, right? So some of the problems, like for example, the problem that we're talking about in patients in an ICU, you have so many different variables that you need to account for. Right from what is the data on that patient's bedside monitor, to what is the medications that patient is taking, what is that patient's past medical history, were they diabetic, were they hypertensive, what are their laboratory results, what does their EKG show, what does their chest X-ray show. So you have so many variables, and what we're trying to do is trying to get all of this data onto one platform where it can be analyzed, where you can use data science. Because traditionally what you have is you have monitor data. For example, you have a patient's bedside monitor that has 5 parameters. It'll tell you what the patient's heart rate is, it'll tell you what the patient's blood pressure is, it'll tell you what the patient's oxygen level is, it'll tell you what the patient's temperature is. And you can use that data, and I mean, you can use tons and tons of that data, but there's only so much of actionable insight that you'll be able to gather from that data, right? Because there's so many unknown confounding variables if you only have those variables available to you. So at some point you're going to hit the ceiling of your area under ROC, so that's one of the things that we're trying to do. Is we're trying to take a 360-degree view of the patient, where we get all the different variables that go into what is going to affect the outcome of this patient, and analyze that to see if we can come up with a better predictive model or a better clinical decision support than what is ordinarily available. Now, this is one problem, but there are so many problems in healthcare. There are problems in healthcare in which there are not a lot of variables. In radiology, you have people analyzing images. In pathology, in histopathology, where you have people analyzing, images of biopsy images. In ECGs, where you just have an ECG, you don't need to take into consideration a whole lot of other things. You just need to analyze what does this ECG say. So those are places where I think data science is far advanced and has come up with some pretty interesting solutions. And again, most of these innovations, most of these solutions come from the fringes. They don't come from the middle of regular doctors who are practicing, who are still sort of averse to utilizing data science, but all things come from the fringes and then become mainstream, and that's probably what's going to happen in the coming few years.
For the last question, I would ask what vision you have in your company, and this is a very formal question, but I want to ask a personal question. That's what kind of vision you have for healthcare situation in India? If it is personal, if it is not that personal, please share it with us.
So, just to give you some background, I was a doctor in the US. I was fairly comfortable there. I didn't have too many problems. But this was, I was an ICU specialist there, and I had seen sort of the advent of technology and how it could be used to improve the delivery of healthcare. And that's sort of what motivated me to move back to India and start this company, was the fact that the problem was much bigger here. And I wasn't the only person that started this company. I started it with my colleague. His name is Dilip Raman, who is also an ICU specialist. We were both doctors in the US, and we were like, let's go back. There's a big problem there. We think we can do something about it. Let's do that. And so my vision is, at least right now, our focus is on ICU patients. The fact of the matter is that there are so many sick patients, so many patients that end up in an ICU due to critical illness, and there are so few ICU specialists. The ICU specialists available in India are predominantly concentrated in big cities like Hyderabad, like Bangalore, like Delhi, in Mumbai. And even within these big cities, they're predominantly concentrated in, the ivory towers of the big corporate hospitals like the Manipals and Apollos, and these are the big hospitals. And the moment you go outside of these places, you have a sharp drop in the availability of specialists, and you have a sharp drop in the availability of quality healthcare. So our goal, our vision was to get quality healthcare out there on the backbone of technology, on the backbone of data science, to all of these places where we're getting access, we're ensuring quality, and we're doing it in a cost-effective manner. That was my vision.
Impressive. Thank you very much. As a person who is working data science in healthcare, I'm still very impressive that a doctor, ICU specialist, has this amount of knowledge about data science, and he can talk about data science and how data science can help him and the future of healthcare. I would say thank you very much again, and it was my pleasure to talk with you about healthcare here in Indo Data Week.
Thanks,
Thank you very much.